What happened to your POTS symptoms?
They were gone. I didn't have any more fainting episodes. And it's phenomenal.
Hey everyone, today we have an incredible and actually emotional interview for you from Ashlee. She was dealing with so many problems and none of her doctors were putting together that the root cause of all this was actually related to autoimmunity. She was dealing with Mast Cell Activation Syndrome, Ehlers-Danlos syndrome. She was also dealing with PCOS, Gastroparesis, all kinds of issues, and she wasn't able to be there for her young child in the way that she wanted to. And that was heartbreaking for her. She also was dealing with PCOS and had begged a doctor to help her toward that diagnosis, but wasn't able to get it until she went through the Transform program. I'm talking about pain and dizziness on a 6 to a 7 out of 10 scale. Wait till you hear what she has to say now. Thank you for joining us. If you're watching us on Facebook, give us a like and join the Transform community. If you're watching us from YouTube, give us a like and a subscribe. We're on TikTok and we're also on Instagram. I am your co-host for the Transform program. I'm Anna Manuel, working alongside Maggie, UMD, functional and holistic medical provider. And she gets it because she is a medical doctor who herself has had autoimmunity. So this is the spot where you want to be if you need help and other doctors are telling you it's not possible. That's what happened to Ashlee. Let's hear from her now. All right, Ashlee, why don't you introduce yourself?
Hi, I'm Ashlee Palmer. I'm 27 years old. I'm the mom of a 2-year-old little boy. I am a seamstress and a costume designer.
Oh, so you have to have energy to be a mom and a lot of energy, I'm sure, for your job as well. And additionally, probably some really good mobility being a seamstress.
Yes, absolutely.
So talk to me a little bit about what's been going on with you medically then, and how far back does this stretch?
This stretches back several years. I think the most noticeable point for me was my senior year of high school, but the roughest part has been the last 2 years. So about a month after I gave birth to my son, I went downhill really fast.
As Dr. Maggie always says, that's a hormonally sensitive period of your life, which can then spur the creation of autoimmune disease and massive symptoms. But from what I understand, doctors weren't necessarily pinpointing you to have an autoimmune issue. Is that right?
No, not necessarily. Right after my husband and I got married 5 years ago, about a month after, I got an MRI and that showed us that I have Chiari malformation. And so December of that year, I had the decompression surgery done. And after that, most of my symptoms were alleviated and I was able to function pretty well, except for like some vertigo and POTS symptoms were still a little rough some days.
That's nothing to glaze over though. Some vertigo and some POTS symptoms, that can be life disrupting. So you had a surgery, great. That may have helped you in some ways, but the autoimmune attack that doctors weren't telling you was actually happening was marching on.
Absolutely, it was.
We're dealing with dizziness. What else?
Lots of fatigue, lots of pain. I had been told by multiple doctors and medical people that you had the surgery, so you're better now. And I was like, but I'm not.
And you know, it's so frustrating. I had a conversation with Dr. Maggie about this. When you have a diagnosis of POTS, you also had a diagnosis of Mast Cell Activation Syndrome. So you were dealing with all kinds of allergic reactions. You had Ehlers-Danlos syndrome. You had all of these things, and doctors, nobody in your life was pinpointing to say, okay, these are actually autoimmune related. They were just saying, we don't know, you had the surgery, we think you should be okay, so we're not exactly sure why you're still not feeling well. And that's got to be frustrating for you to be told, well, there's nothing we can do now.
Absolutely. And most of it I figured out on my own doing research. And then I found a doctor who specialized in it and I went to him and I said, hey, look, here's what I'm experiencing. This is what I think I have. And he goes, yep, you do. I said, okay, what can we do? And he said, well, we can try to maintain your quality of life and just treat the symptoms as best we can. And that's about all we can do for you. And
Unacceptable.
Devastating, especially as a new mom.
On a given day, were you saying you would have A 1 to 10 of your symptoms, pain level, and just interrupting your daily functioning. What was that on a scale of 1 to 10?
Goodness, probably a 6 or 7.
What was the primary thing that was bothering you?
Mostly the vertigo, because it's next to impossible to try and wake up in the middle of the night and walk down the hallway to your child's bedroom and bend over and pull them out of the crib when you can't even walk straight on your own. So it's hard.
Emotionally, what is that like, Ashlee? You know, you want to be the best mom possible for your child, and you're feeling like maybe you let me know you're not able to be that mom you want to be. What did that feel like for you?
It's soul crushing. I had multiple miscarriages before we were able to have my son, and we had come to the conclusion that we are happy with getting even one, so we're not going to push things further than our luck will allow. And so not being able to enjoy those little moments when he was little, the first time he crawled, first time he walked, it wasn't able to actually enjoy those moments because I was so dizzy and in so much pain, and I kind of felt like a failure as a mom because I had to call other people to help me to get my child out of the crib and bring him to me in the morning so I could nurse him because I couldn't get out of bed to do it. It was heart-wrenching.
That is a devastating feeling for anyone, especially a new mom, feeling like they cannot adequately function to take care of their child. And you're not getting help from doctors, you're getting no answers, and it seems like your problems are getting worse and worse. So, talk to me a little bit about how was it that you decided to join the Transform program and have this prayer to turn it all around?
All credit goes to my amazing mother-in-law. She just would not accept any of the answers that the doctors were giving us. And she's like, there's something out there. I know there's something out there. We've got to find the answers. We've got to find the root cause of the problem. And everyone's saying, oh, it's genetic. There's nothing you can do to fix this or treat that. But she didn't take no for an answer. And I had reached a point where I had just kind of resigned myself to my fate. But she found Dr. Maggie on YouTube and decided to do her hormone program. And from there, she's like, we got to do this. We're doing it this summer and we're going to do it together and you can't say no.
So, because she had amazing results, it sounds like, and she wanted the same for her family, for her daughter-in-law, mother of her grandchild, to say, okay, this is not acceptable. There has to be another answer. And so, before we get into what happened with you in the program, you were at a non-functioning level and in a 6 to 7 dizziness and pain. I want to hear, how far out of the program are you now?
I'm a month out of the program now.
Okay, so just 1 month out of the program. And Dr. Maggie always says this is launching you into a year of autoimmune turnaround. So still very early on. Where's your pain level now and where's your dizziness now?
Oh, I'm functioning at like a 2 on an average day for pain, which is phenomenal. I'm not dislocating my joints every time I sit down on the floor to play with my son. I'm able to sit on the floor and get back up again. I can clean the house. I can cook dinner. I have the energy to do that at the end of the day. Whereas before, my husband would get home and I'm literally on the couch about to fall asleep while my toddler's throwing toys everywhere because I had no energy left.
So what I'm hearing is you can now be that mom that you wanted to be.
Absolutely. And it's so fulfilling to be able to be self-reliant in that way when for 2 years I couldn't. And it feels like I'm rediscovering myself and who I am and who my family is now.
And doctors will tell you, impossible. You know, you can't turn around these issues. You're going to have them forever. Best we can do is make you comfortable, is what I think you said one doctor said to you. So people want to know, okay, how did you do this? Let's share what happened to you in the program that you were able to go from these unfunctioning levels to being able to live a normal life.
I think I found a little bit of success in every single step of the program. I had been told to drink 100 to 120 ounces of water a day for my POTS symptoms. And I was at a point where I was having to get IV infusions every 3 or 4 weeks because I had no minerals or vitamins left in my body. I was completely flushing them out. And so just drinking the proper amount of water to start with made a huge difference, especially with the vertigo. I was shocked.
Mm-hmm. The Transform program, for anybody watching, tailors the water level. It's not just, oh, you have to drink whatever your doctors were telling you before, this massive amount, 100 to 120 ounces of water. This is tailored. It's a specific formula for you to know that this is the appropriate amount of water to drink to function appropriately. All right. So water intake, that was one. What else?
Blood sugar balancing. I thought I was doing great. You know, I didn't really eat sweets or sugar or drink lots of juice and soda. And I mean, it was like once a month I'd have a Coke, and that was about it. But learned so much from the program, and actually balancing my meals and lowering that spike and plunge in the blood sugar. I haven't had any vertigo issues since being able to figure that point out from the program.
You know, I have a question for you here, because when you talk to your previous doctors about your POTS symptoms, oftentimes I'm sure they'll let you know, oh, this is a cardiovascular issue. We have to get it under control from a cardiovascular standpoint. But what they fail to recognize, and what Dr. Maggie has realized and preaches in her program, POTS is not cardiovascular. The number one cause of it and all of the symptoms involved goes back to blood sugar. So once you got your blood sugar under control and you learned exactly how to do that appropriately, what happened to your POTS symptoms?
They were gone. I didn't have any more fainting episodes. I used to have to wheel around the house in like my computer chair to keep up with my toddler. And I didn't have to do that anymore. I haven't had to for 3 months now, and it's phenomenal.
An amazing feeling, and it's going to continue to get better. All right, so you had water, you had blood sugar. Anything else in the program that you felt was very impactful?
Figuring out what exactly my food allergies were. Before starting the program, I was living off of meal replacement shakes and was told that I needed a feeding tube. And I didn't want to go down that rabbit hole, because everything that I had seen, it was once you get the feeding tube, it goes downhill so fast at that point. And so I was fighting it tooth and nail and figuring out what exactly were my food allergies, and cutting those out gave me so much food freedom. And it's wonderful to be able to enjoy food again.
I'm curious, how was food mapping for you different from every other food testing you had had previously?
Previously, it was just oh, we'll try cutting this out. Oh, we'll try cutting that out. And it wasn't consistent. Like Dr. Maggie teaches, you need to cut it out for at least 8 to 12 weeks. And most of the other doctors were having me do it for like 2 to 4 weeks. And that's not effective at all.
Right, right. And food mapping is so much more than just food allergy testing, as I'm sure you learned throughout the program. And people with Mast Cell Activation Syndrome, as you well know, they can't eat a lot of foods. They're very limited. So I'm curious, now that you have figured out your food mapping specific to you, what is your diet like?
Oh, I can eat so much now. Lots of fresh fruits and veggies. Things that I couldn't eat before. Like before, I couldn't eat anything with vinegar.
Mm-hmm.
It would make me so sick and have exponentially worse migraines than I was already having. And now I can have a vinaigrette dressing on my salad and not bat an eye, and it's phenomenal.
It's amazing. People are always curious about food mapping, and people do get nervous. Oh, I don't want to have to cut out these foods out of my life. But time and time again, what we see is that through food mapping, so many people can introduce more foods that they had previously not been able to eat. And that's life-changing for a lot of people to suddenly have options, to not feel like they're going to get sick all the time, to not have that anxiety about eating. And that's what you experienced as well.
Oh yeah, I will happily give up my dairy and my garlic in order to be able to eat all my fruits and veggies again. Like the trade isn't even worth a comparison.
And so that's what it was for you. Garlic. Would you have ever thought garlic was the culprit?
Absolutely not. And it's in absolutely everything.
But now you know to look for it, and you've got options, and there are other foods that you could replace it with. You're not missing it.
Absolutely not.
I think through the program, you had mentioned you wanted to be able to travel, and that was something that you just couldn't do before joining this program, right?
So my husband travels a lot for work. And after having my decompression surgery, I was able to travel and fly around with him a lot. But after I got pregnant and we had the baby and I had recovered, we thought, okay, let's try this again with the little one and take him traveling. And I would be in immense pain, awful migraines for almost 2 or 3 days afterward, and just not be able to actually enjoy going anywhere. A month ago, I was able to go to Alaska with my husband for a week.
What?
And I was able to hike more in 3 days there than I have in the last 3 years. And it blew my mind how much energy and how much I was able to accomplish that I'd never been able to before.
Ashlee, you went to Alaska. This is the
Yeah,
stuff I did for most people. I mean, would you have ever thought you would have the energy and the wherewithal and the physical ability to go to Alaska and go hiking before you started this program?
Absolutely not.
That's just a dream. And these are things now that you're living your life. You're able to accomplish the things and do the things that you want to do with your family and have these memories that are priceless. I'm curious, was there a point, or was there something, I know your mother-in-law was really pushing for you to join the program, but what was holding you back maybe from joining? Were there any reservations?
No, I was at a point where it was do or die, basically, is what it felt like.
Mhm.
So any option besides the no option that my doctors were giving me was great.
And what did you discover in the program that surprised you? Maybe something about you weren't expecting with the community aspect.
That was very welcoming for me. I loved that because most people with autoimmune diseases or chronic illnesses feel very isolated and alone. But being able to be introduced to this community and having our weekly pod calls with other people who were in pretty close to the same boat was wonderful, to be able to talk and compare stories and be able to actually understand what someone else was going through in a way that no one else could.
I'm hearing also maybe some undertones of mindset work for you was pretty big.
I mean, I'd had a second chance already with my decompression surgery, and so thinking a third chance was probably not going to be very likely. But going through the mindset work really helped me focus on the gratitude of the small victories I was getting every day.
And I'm curious to hear too. I always like to ask people, what was it like working with Dr. Maggie? You know, people wonder, oh, do you really get to work with Dr. Maggie? What is she like to work with? So give us the honest truth here.
She's so fun and energetic and entertaining. And I feel like she turns what most people see as a very depressing situation into a very exciting and adventurous one.
Yeah,
And
you're able to have fun. You're able to have fun in a situation where you're learning and you're transitioning your health completely around. And It's that positive outlook and that positive attitude. I mean, she knows she can do this. You know, you go to doctor after doctor and they say, we don't know what to do for your POTS. And she says, I eat that for breakfast. We've got this. Let's just learn about how we're going to turn it around and have some fun along the way.
Yes, we use that catchphrase a lot in our house now. I eat that for breakfast.
Well, you can eat a lot of foods for breakfast now, quite literally.
Yeah, absolutely.
And also, it sounds to me like your mindset has really changed from, I've got this, I can tackle this. Anything that comes my way, I know how to handle it now. And I know the steps that I need to take to get better if something comes my way and I have any kind of setback.
No, absolutely. This last week in Arizona, we've had some really good monsoon storms. And previously, when a monsoon would come through, I would be completely non-functional. Just the change in the barometric pressure really messed with my body. And I was able to go out of the house and drive and go puddle stomping with my toddler, things that I thoroughly enjoyed before, but couldn't enjoy anymore.
Yeah, you're living the life you want to. And Ashlee, you know, there's so many other women and men out there who are in the same position you were in 3 months ago. What do you want to say to somebody who might be watching this that was where you were a few months ago now?
Just don't give up. You've got to believe in your ability to take care of yourself, not just those around you, but take care of yourself. Once you make that a priority, all the other pieces fall into place very easily. You don't have to force or reshape anything.
And what does your husband think about your turnaround?
He jokes a lot that he has to start dating me and getting to know me again because I'm able to express my personality more because I'm not dead tired.
You're able to be you. You're able to be the you that you always were, but it was just all of these medical issues compounding on top of each other that were holding you back from being the true Ashlee.
Yes.
Yeah. Anything else you wanted to share with us that I didn't touch on?
I do have one that just popped into my head. I had fought with a couple different OBGYNs about how I thought I had PCOS because I was having so many miscarriages. And I just kept getting told, no, you're too skinny to have that. That's not possible. And doing this program, we were able to confirm that. And now I'm able to start to fix that. That was like my big aha victory moment of I was right. I did know my body, and this program has helped me to further confirm that and build my confidence in understanding myself.
Absolutely. And this program has given you a master's degree in your own health. So you are now, without a doubt, smarter than your doctors that you were seeing previously. And what's so frustrating is OBGYNs are not hormone experts. And to hear somebody tell you that they could tell you that they were able to not diagnose you or to diagnose you with PCOS just by looking at you, that is total crap, because that's absolutely not how it works. Sure, there may be signs and symptoms with PCOS that you can see outwardly, but to just look at you and say, oh, you're thin, you definitely don't have this, when you have so many of the other symptoms and you're struggling to determine, why am I having repeat miscarriages? When now you probably realize, oh, this was all related to autoimmunity from the get-go, it makes a lot more sense. And you know what to do with it now, and you know how to fix it and balance it out, because OBGYNs are not hormone experts.
No, they're not. And it's wonderful and refreshing to be able to take back that control for myself and not feel like a slave to the medical system.
Yeah. Yeah. And it's got to be hard to think about all of the heartbreak that you had to endure because you weren't getting that help. How many miscarriages did you suffer?
I had 3.
I'm so sorry to hear that. I cannot imagine how challenging that must have been for you, both physically and emotionally. Very thankful that you do have a 2-year-old though now, and you have a path forward to help your body function optimally. And that's all you can ask for.
That's more than I could ever ask for.
Well, I'm so happy for you, Ashlee. Thank you for spending your time with us today and being so generous and sharing your story. I know it's going to help a lot of other people.
I hope so.
Thank you.
Thank you so much.
Hey everyone, that was an incredible interview, case study from Ashlee. So many people out there are suffering from all these myriad of, people think, non-autoimmune related mystery illnesses. We're talking like POTS, mast cell activation, Ehlers-Danlos syndrome, PCOS that her OBGYNs, who are supposed to be the expert on hormones, can't even diagnose because she's too skinny, despite the fact that she was having all these miscarriages, which are also autoimmune. I love the fact that Ashlee is so powerful that she now is smarter than all her doctors, because she's making all these connections that these are all connected and they're all just different targets of autoimmune attack. So I'm thrilled with how this young lady really, with the support of her family, was able to really get an education beyond all her doctors combined, and to be able to connect all the dots, understand the underlying root causes of autoimmunity that's feeding all of those. Here's the thing. If you're watching right now and you yourself are suffering with these symptoms, or you know somebody who's suffering with any of these diagnoses, I want you to tag their name right now, so that, because you know what? I'm asking you to raise awareness around autoimmunity, and there's so much misunderstanding and misconceptions and lack of education out there among our medical community. So if you could tag anybody that you know that could learn from this, tag them in the comments below if they're suffering from any of these. And if you want to learn more about working with me and our Transform Fundamentals program, there's a link above or below this video to chat our team. You can also make sure you join our Facebook group, Transform Autoimmune Disease Naturally. And if you're watching from TikTok, socials with IG or YouTube, make sure you click a like and a subscribe. And we're going live all the time. Thanks, everybody.